In this video, we are going to be exploring the hot topic of global warming and its impacts on human health. Is global warming real? And how does it affect our health? How does it affect wildlife and animals who relies on our climate? How does it affect our food? How will it affect our future and what we can do about it? Let's find out what science has to say. Chapter 1. Is global warming real? NASA's analysis generally matches independent analyses prepared by the National Oceanic and Atmospheric Administration, NOAA, and other research groups. Overall, Earth was about 2.45 degrees Fahrenheit warmer in 2023, which equates to about 1.36 degrees Celsius than in the late 19th century, 1850 through 1900, known as the pre-industrial age. That might not sound like much, so why are people so alarmed? Even this 2.45 degree Fahrenheit degree difference is causing big changes. We will go into those later, but what is causing this warming? Primarily, we humans have only to blame. The burning of fossil fuels like coal, oil, and gas releases greenhouse gases that trap heat in our atmosphere. It's like we've wrapped the Earth in a big warm blanket. That blanket is getting a bit too warm. Chapter 2. Health-related problem with global warming. Rising temperatures and more frequent heat waves can exacerbate conditions resulting in many human health conditions. First, let's look at heat-related illnesses. Condition number 1, heat stroke. This is the most severe form of heat-related illness and occurs when the body's temperature regulation system fails, leading to a rapid increase in body temperature, potentially causing damage to the brain, heart, kidneys, and muscles. Condition number 2, heat exhaustion. If untreated, it can progress to heat stroke. Condition number 3, heat cramps. These are painful muscle spasms that occur during or after intense exercise in high heat. They are considered the mildest form of heat-related illness. Extreme heat can exacerbate existing health conditions such as cardiovascular disease, diabetes, and respiratory issues. The risk of these illnesses is heightened for certain populations, including older adults, children, people with chronic illnesses, outdoor workers, and those living in urban heat islands or areas with poor infrastructure. As climate change continues to drive up temperatures and increase the frequency of extreme heat events, the incidence of heat-related illnesses is expected to rise unless effective adaptation measures are implemented. The rising temperatures also cause mental health illnesses, which we will cover in a follow-up video. For this video, we are focused on the physical problems and what can be done to help. Chapter number 3. Infectious diseases. Rising temperatures allow disease-carrying insects like mosquitoes and ticks to survive in new geographic areas, expanding the range of vector-borne diseases like malaria and Lyme disease. Increased pathogen survival and reproduction. Warmer temperatures can accelerate the life cycles of pathogens and increase their survival rates, leading to greater disease transmission. More frequent floods, droughts, and storms can disrupt sanitation systems and create conditions conducive to disease outbreaks. Warmer temperatures also increase air pollution and extend pollen seasons, which worsen respiratory problems. Research has found that 58% of infectious diseases confronted by humanity have been aggravated by climatic hazards at some point. While some diseases may decrease in certain areas due to climate change, the overall trend suggests an increased risk for many infectious diseases globally. This underscores the need for enhanced disease surveillance, preparedness, and mitigation strategies to address the health impacts of climate change. Chapter 4. Food and water insecurity. Extreme weather events can disrupt food production and water supplies, leading to malnutrition and waterborne diseases. Rising temperatures and changing precipitation patterns can decrease agricultural productivity in many regions, especially in tropical and subtropical areas. Heat stress, droughts, and floods can damage crops and reduce yields. Rising CO2 levels lead to ocean acidification, which threatens marine ecosystems and fisheries that many communities rely on for food. Global climate changes alter rainfall patterns and accelerate glacier melt, leading to water shortages in many areas. This affects both drinking water availability and irrigation for agriculture. Chapter 5. What we can do locally. On a local level, we can promote sustainable transportation by encouraging the use of public transit, cycling, and walking. We can improve energy efficiency by retrofitting buildings with better insulation and energy-efficient systems. Adopt smart energy management technologies and encourage the use of energy-efficient appliances. We can also install solar panels on public buildings and homes, support community solar projects, and advocate for clean energy policies at the local level. We can promote community gardens and support farmers markets, encourage plant-based diets, and reduce food waste while supporting sustainable agricultural practices. Chapter 6. What can be done on a global level? Number 1. Strengthen and implement global climate agreements, like the Paris Agreement, and collaborate on research and technology transfer for climate solutions. Implement carbon pricing mechanisms and set realistic emissions reduction targets with education. Number 3. Invest in research and development of clean energy technologies and support the scaling up of existing climate solutions. Number 4. Promote climate education in schools and communities, and awareness about the impacts of climate change and the need for action. On a global scale, we need policies that reduce greenhouse gas emissions and promote clean energy. Now, I know some of you might be skeptical. You might be thinking, is there a scientific consensus on this? The answer is a resounding yes. Over 97% of climate scientists agree that human habits have a great effect on global climate change. Remember, while individual actions are important, we also need systemic change. It's important to understand how your specific location might be affected so you can prepare and adapt. Support policies that address climate change, vote for leaders who prioritize this issue, and get involved in your community's sustainability effort. Global warming is a health crisis in the making, but it's not too late to act. Every action counts, no matter how small. Together, we can create a healthier future for ourselves and our planet. Thanks for watching. If you found this video from Health Equals Wellness helpful, please like and subscribe. And remember, our next video will do a deep dive into the mental effects of global warming. And remember, stay cool and keep our planet cool too.